Have one other person on the agenda for a very short summary of some specific information. Russ Mobley.
Thanks, Richard. I want to keep it short. I started looking at healthcare about 4 or 5 years ago as it related to us here in the county and in Northeast Georgia as well as a nation. Over the last year, in speaking with Richard and June, Chris, I agreed to try and get some speakers to talk at this meeting. I talked to my primary care physician, the staff of our local hospital emergency room, Habersham Medical, the administrator staff of that hospital, an affordable health care insurance navigators group out of Gainesville, several different groups, by the way, and Congressman Doug Collins' staff. All of them were reluctant to speak with me. Also spoke with Kaiser Permanente. They didn't want to get into this highly polarized discussion. So I ended up having to come up with my own stuff. Nationally, the state of healthcare industry, from 1990 to 2015, U.S. hospitals' uncompensated care costs totaled $704 billion. That's according to the most recent American Hospital Association report. In 2015, the total uncompensated care costs were only $35.7 billion, one of the lowest years in the past, all attributed to the Affordable Health Care Act. Locally, as many as 600,000 Georgians, 650 according to another speaker, are stuck in the state's coverage gap because they don't qualify for Medicaid or are too poor to buy health insurance through the ACA's insurance exchange. Since 2010, Georgia hospitals have seen some $700 million in Medicare cuts due to legislative or regulatory action, according to the Georgia Hospital Association. By 2025, we expect an estimated shortfall of $12 billion. And they hit the rural hospitals especially hard. For most rural hospitals, Medicare and Medicaid make up 70% or greater of all the monies that come into the community to pay for things in hospitals. 15% of non-elderly residents in White County and rest of Northeast Georgia are 5% higher than the rest of the country is uninsured. 6 rural hospitals in the state have closed since the beginning of 2013. 2 of those have been reopened as modified medical facilities. More than half the state's remaining rural hospitals are right on the verge of being closed. Habersham Medical last year reported a loss of $1.6 million. The CEO was fired last month, related to the hospital's financial condition. Options, opportunities, solutions, or obstacles? Beats me. The Emergency Medical Treatment Labor Act, or EMTALA, which is a federal law requiring hospitals to treat anyone coming into the emergency room, regardless of their insurance status, was passed in 1986, but it provided no funds to take care of it. The largest single unfunded mandate in the history of the United States. The majority of hospitals' losses are from the ER. A few congressmen have suggested repealing EMTALA. Paul Brown was one of them. A physician. There's no real interest in funding the mandate since its passage since 1986. Tort reform has been proposed by medical groups and conservatives. It could save up to 2.5 to 4% of the cost of health care based on the state. This amounts to, say, $65 to $85 million. Patient advocates and trial lawyers argue malpractice will increase. Any legislation will require some checks and balances or metrics. Some other options are everyone gets covered. Providers paid for a uniform rate. It could create a real spending leverage. The U.S. already has a single-payer system, Medicare and Medicaid. But the cons of that are a funding mechanism would have to be created. Longer wait times for some specialized services are going to have to be an issue. Canada, UK. And healthcare costs are not going to disappear. And there's always the possibility of reduced impetus for innovation. In summary, the U.S. pays more for healthcare than any other developed nation on the planet with the lowest outcomes. We're currently ranked behind Romania. That's Transylvania to most of us. We have to first determine what we want in our health care, and all of them have implications. Do we want to be the best, the most efficient, most universally available, or a hybrid of 1 and 3? What we do rank number 1 is, as some of the other speakers have mentioned, we are number 1 in inmate incarceration, number 1 in number 1 in plastic surgeons, number 1 in multimillionaires, and number 1 in child poverty in developed nations on the planet. Some combination of item 4 that I mentioned earlier has to be considered to realize some gains toward a real solution. It all has to include some form of metric, something you don't see in any legislation or very few government systems or situations that we look at today. If we're going to do this, not get emotional about it, but what are we willing to do and how do we measure? It takes us as well as our politicians to look at it thoughtfully. Thank you.